Hello, everyone. Welcome to the Couple of Nurses Show. Here with the hosts, Peter and Matt, two nurses on a mission to change this world, one conversation at a time. Thank you, everyone, for tuning in. If you find value in the show, please share and review this show. It would mean absolutely everything to us. couplenurses.com for the latest updates, merch releases, and show notes, and also the resource page. For Lifestyle Podcasts, you can check out wearefootironwarriors.com. In this episode, we would like to introduce you to Raj Sundar. Raj Sundar is a full-spectrum family physician and community organizer. He hosts Healthcare for Humans, a podcast dedicated to educating others on how to better care for culturally diverse communities so they can be better healers. Hey Raj, thanks so much for your time. Thanks so much for being here. Can you give us a little bit back about yourself and how you got to where you are today?
Yeah, thanks for having me. My name is Raj Sundar. I'm a family physician, and I still consider myself full spectrum, that I do prenatal care, so take care of people who are pregnant, and then deliver as well. So I go to the hospital and deliver babies. It's one of the most rewarding parts, let's say, of my job. In addition to that, I have a family. I have 2 kids. We're small, and I'm here in Washington State, in Seattle. And my journey is long and winding, I guess, but not as winding as other folks. But I did grow up in India and joined my parents in North Carolina, and then moved to Washington State for residency, and then I've stayed here since.
And how did you start the Healthcare for Humans podcast? I know you have another passion you got excited about other than being a family physician, right?
Yeah, that's some thread of my journey in life. Is I'm a family physician, and I said, there are a lot of rewarding parts of my job. At the same time, I think we all can relate to it in that when we're part of healthcare and healthcare systems, it feels like we're letting down our patients because how our systems are set up. And I'll be kind of specific. For me, as a family medicine doctor who sees patients at clinic, the obvious limitation is I see my patients for like 15 minutes at a time. And I take care of a lot of different people, and then I take care of immigrant communities and refugee communities. And what I felt that was really difficult for me was caring for them in the way they want to be cared for, especially when their values, beliefs, and worldview was different than mine, right? Whether it's the Khmer community, which is Cambodians who've suffered from community trauma, or Somali community who have specific beliefs and have also experienced trauma. They come to this Western healthcare system to receive the care they want, and then it just feels like they don't get what they want. And so there's a bigger level of healthcare systems and how do we care for communities there, but just individually, I feel like I didn't understand the culture and the community well enough to care for them. So to bridge that gap, I started this podcast because the Healthcare for Humans podcast, the goal is to educate clinicians to care for culturally diverse communities. I chose podcasting because of this, and I have 2 kids, and I was doing a lot of dishes and chores, and podcasting was a beautiful way of multitasking and still learning and meeting some of my needs. And there's power in voice, story, and conversations to communicate something complex, especially something complex as culture. Because have you both done any cultural competency modules?
I want to say maybe, but that's like ran through real quick just to make sure I have all my C's or whatever the requirements are to still be a nurse. Yeah, to be honest, those if you're able to click through it, we probably did.
Exactly, right? We all click through stuff, and this huge important thing for people is something we click through because the content is kind of boring and it's often a checklist. It's often stereotypical, and the takeaway is like, listen to people, right? Like, that's the takeaway you come away with. And I felt like after doing those modules, it was so incomplete because it was like kind of stereotypical and limiting. And podcasting was a way to go deep into something. And you all have found that here too, right? You can really get into the nuances and unpack things and leave room for contradictions because culture is that way. So when I go to somebody in the Somali community and I interview their leader, they're going to tell me all the ways healthcare falls short for them. And then we can go over details we want later. And they could explain the nuances in their own voice. So give space for the community itself to speak for themselves rather than me going and studying them, which we often do with healthcare too.
And Raj, coming from India, I'm not sure what age you came from India at, but just coming from India, did you felt there was like that lack of cultural awareness just by you coming from India here to the US?
Maybe. I think I was young.
Okay.
Right. So when I came around, I don't know, I was probably 7 or 8 years old. I think what stuck with me is the openness to experience because everything was different. And this memory came up for me, but sometimes random memories come to you. I was talking to somebody about just how different it is to come to America. I was like, oh yeah, like, what was really different? The toilets. Where I was in India, we had the Easter toilets where you squat on the ground. And then I came here and, you've got these toilets that you have to sit on. I was really young, so I came for the first time living with my parents. And my parents, were really worried one night. I remember and, knocked on the door when I was in the bathroom. They're like, are you okay in there? I just remember this memory of, I tried to squat on the toilet because I was like, that's how you sit on toilets, right? So I was, trying to balance on top of this Western toilet. I was, slipping, everything hurt. Are you okay? And then eventually, they told me about it. But that was just an example of how different things can be. So it allowed me to be open to different people's perception and worldviews and challenge my own assumptions. So I think I've carried that with me. So I don't default to this is how it should be done as easily as sometimes we can default to because we're human.
I love the perspective you bring. A few episodes on, we had a patient that was in the ICU, was intubated and experienced delirium. She shared her experience where the healthcare system lacked support emotionally and psychologically. And again, it's very multi-factor. You come into the show and you bring up the gap that we don't have culturally. And if you were to kind of take a shot at it, maybe throw a dart at the wall to see how we could potentially fix this, because ultimately it affects the patient care, right? And the front line is the hospital, healthcare system. That's where most people go. They see this gap culturally. So how can we bridge that gap where we're more culturally sensitive if you were to take a shot at it any kind of way?
Yeah, I think from a high level, healthcare system, there's value to autonomy and self-determination of having a pot of resources saying, hey, your community is here. You know best of how to care for the community. We'll support you. And here are some resources and money to build clinics the way you want, build healthcare with indigenous forms of healing. When I say that, people hold traditions of healing within their cultures that they want to bring into health as well. So incorporating that and creating a system that works for you, and we're here to support you, right? If you don't have to build your own hospital, we'll make sure we work with you. So there's a way to do that as big systems. I think at the individual level, we could all benefit from more education too. When I say that, people sometimes get overwhelmed. They're like, wow, how many communities are there? How many cultures? How many countries? How am I supposed to learn it all? And I try to pause people there because often in your neighborhood or the hospital that you're part of, there's a handful of communities. Even in the most diverse communities, there might be 30 or 40. We've memorized so many things in medicine and rare diseases and protocols. This should not be something that seems daunting to you. Understanding the communities that are in your neighborhood, especially its hospital system, and what matters to them, and how can we change our relationships to them. The last point that I'll make is I've been deep into thinking about how people are critical of our healthcare systems, right? And I don't know if you've heard of Victoria Sweet. She wrote God's Hotel and Soul Medicine. I think that's her newest book. And I think the other book that I was reading was Victor Montori, which is Why We Were Bold. And I'm trying to incorporate how people were really knowledgeable about the system and envision a different future. And one thing that always comes out, which seems so obvious, is making healthcare slower, which is 15-minute visits here. And I know both I've done and traveled are saying, there's so much time pressure because they're expecting productivity, want efficiency and resource constraints, but making things slow down and helping patients be seen for who they are goes a long way too. Because culture is just one part of it, right? I'm Indian, but there's so many different kinds of Indians, and me as an Indian is only part of my identity, and you wouldn't really know that until you know me. And most systems right now, or the ways they're set up, are designed to know people well.
Mm-hmm. And then Raj, while you're speaking out, I was thinking you're saying to slow down healthcare in a way, slow down medicine. But what's like an idea that you have to maybe slow things down? Because doctors and physicians and anybody in healthcare practitioners, they're always overall with patient. They always have a high patient load where it seems like their time is dwindling every year, every month. They have these new quotas they got to hit. They got to bring in more patients from the hospital. Hospital has to make more money every year because it's not seen as like a good revenue stream. So how can you really slow things down? Do you think maybe hiring more physicians, more healthcare providers? What's something that we could do to help slow things down? Because in this fast-paced society, it's more of like every year you have to be quicker. As humans, like even look at cell phones, we want things to be the fastest. At fast technology, you want to get in, get out. You want to just be focused on speed, where you could go and treat, and then have the patient leave or discharge them, or maybe just do another consult next month. How can we slow things down in a society that's so focused on speeding things up?
What a deep question, right? You want me to challenge humanity's progression right now. I will say there are so many ways to respond to that question, right? Yes, there's a question of resourcing. If you have more staff, more clinicians with less patient load, less patient visits, that'll naturally make things slower. And that is a different conversation of how can that even be possible in our current system. But I do think with our culture, I'm using that word as like our technological culture and our expectations of what healthcare should be, is moving towards convenience and efficiency, which has its value. If I show up to you with the STD, I want my antibiotics as quickly as I can, and as conveniently as I can. But if my mom has cancer and we don't have a cure for it, I want her to be cared for as an individual. I'm not looking for just convenience. And there's a depth to that relationship I don't think will change. So I think the slowness, even in our fast-paced culture, is important when somebody's going through life-changing diagnosis or when somebody has multiple diagnoses. And we have a lot of people living like that, right? With diabetes, heart disease, just had a heart attack, and their family is also struggling with health issues. I think there's value to be known at a deep level and have continuity with the same person there. And then even in our current system, I just bring it back to myself where I'm seeing patients in 15-minute, 20-minute increments. Can I slow down medicine right this moment? Is that possible? And that is a challenge that I pose to myself, and I think it's possible. And I think I brought this up. You all talk about mindfulness and presence a lot because there's a way we carry our bodies and our routines that we go through the day that everything's a blur. But I do think I can be really mindful in the day-to-day activity that I'm doing to help people feel like they're being heard and seen. I'm kind of talking very abstract right now, but I'm gonna bring it back down. It is, let's say I just saw a patient that is from Ethiopia. And I've done a few episodes on the Ethiopian community. It's not comprehensive because it's hard to cover entire country's history of a culture. But I learned enough that I have the foundation to talk to patients from Ethiopia living in my community. So when I'm with them, yes, I talk about the medical problem, but also talk about how they're internalizing the conflict that's happening in their country. And you may or may not know this, but there's a lot of conflict in the country, and we won't go into that. But I know that because of having this conversation and how that is weighing heavy in the mental health of that community, because they told me directly. So now when I bring it up to my patients, it feels like to them, I'm not rushing through the visit of like, okay, here's diabetes, here's some medicine, take this, I'll see you in 2 weeks. But like, yeah, here's what I want to do with that. But tell me, like, I know this has been affecting a lot of people in your community. Has that been affecting you too? And I think then they really open up in a way that even though the time hasn't changed, it feels like we're connecting at a deeper level.
I'm kind of thinking about how we can improve this. I had an idea where I was thinking about a patient that I had where she was Spanish. She was very in distress because nobody has time to bring an interpreter next to the room to understand each other, right? We say we have to understand the culture, but sometimes we're in the speed of healthcare so much where we can't even communicate language to have some kind of regular baseline. I decided to take time, put the interpreter on, and change her dressing. She had like a lab procedure with some, lab. So she had a weird procedure because she did it half in Mexico, half here because it got infected. So she had like tubes or some piping to close this down. I don't know how to explain it, but anyways, PVC piping. What happened is I actually took time for the interpreter to communicate with her for 10 minutes, and she was actually calm. Her heart rate went down. She was actually able to take a power nap. And imagine if we had a tool, like you mentioned, we're able to spitball some things in her culture, we could go provide better care. Maybe we could interpret or merge AI somewhere with healthcare where this AI gives us a background of what's happening in their, you said utopia, what's happening in utopia, like the news, what do they like? For example, people in Chinese culture like a warm cup of hot tea in the morning. So you're able to better care to these patients. Like, wow, he actually knows that I like a hot cup of tea in the morning. So I'm thinking of what ways we could implement to slow it down or maybe just get faster at the thing, because not everybody can have the proper education to understand like 200 different cultures, but maybe we could understand it by helping, nurses and technology work together in a way.
Yeah, I'm ready. Let's create this together. I love it. I think there's two ways of thinking of that. One is, let's say, I'm going to say just where I am right now. There's a large Ethiopian community. I'll use that example. Or I can use, there's a large Native Hawaiian community. And then many people may not have that. I think there's value to both of having this vision that you have. And for me, reaching out to the community leaders and building relationships with them, right? Because that's how I'm learning about the community. Because in the future, now I have the relationships and I can reach out to them if they have more questions. So there's value to you building relationships with the people that you're taking care of. And this tool, imagine, yes, like how like 10 different communities that are commonly come to my hospital or my clinic. But what about if there's like few people visiting from a different country, or it's only like 20 people from Nepal here? Like, how much can I learn about that community quickly? And having something like this where I could totally imagine like a crash course or something, like when you have the EMR come up, it also highlights like, hey, people from this community, this is what they value. Again, you got to be really careful about stereotypical. So there's education around how to use them, because you get the knowledge about what's important to them, the values, what decision making can look like. And then you present to the patient of like, hey, like, this is what I know could be important to you. Is that true for you? And they could say like, I'm a second generation Nepalese, like I'm barely connected to my Nepal culture, right? Or they could say, oh, thank you, like, yes, like that would be really helpful. Because right now, a lot of the interventions are focused on community health workers and patient navigators, right, who are from the culture to bridge that gap between healthcare and the communities. And I think there's yes and of people and technology, and people willing to invest in a technology that may or may not make them a lot of money. Because I feel like a lot of the ChatGPT API craze right now is going directly to places that will make it easy to monetize, right?
Mm. Yeah, that's usually how things work. You have to monetize a new idea for it to kind of get pushed on a track and get used a little more. Like, that's why you always have that, unless some things always have like this high bridge to entry, and once that high bridge to entry is broken, you could say it's more accessible to the public sphere once that threshold is kind of hit. But Raj, working in prenatal care and even labor and delivery, is there some interesting cultural situations that you have ever been in? Because I know when I was in nursing school, in my clinical, we had a high, I think it was a high population of, I'm not sure if it was Indian or if it was Middle Eastern families where they wouldn't allow males in the room during the labor and delivery process. So has anything surprised you culturally working with with women and then also in the labor delivery process?
Yeah, I think there are a lot of the situations that provoked or inspired me to do this work in a more intentional way happened in labor and delivery, right? We take care of a lot of communities with different beliefs on what labor and delivery should look like. I'm not in that stage to talk eloquently about the nuances of it, but being a witness, in the labor and delivery floor, I've seen many examples of what I'll say derision of people's culture. So, for example, a Somali woman, and I'll keep this vague for confidentiality, but was in labor, and then there was the fetal heart tracing. It sounds like you all have done OB nursing. The fetal heart tracing wasn't looking great, and then went into category 2, meaning we were a little worried that maybe category 3, but it's hard to say. You're in those situations a lot, right? The uncertainty. And we do know that fetal heart tracing is in itself not 100% predictive of bad outcomes. It's actually a poor marker for predicting neonatal seizures or poor outcomes, but it's the only tool we have, so we relied on it a lot. But when it was happening for a prolonged time, in that situation, and when the Somali patient was in labor, the team in charge, or the attending in charge, recommended C-section. And they went in and had told the patient said, no, right? And these are the hardest situations because you can't force somebody to have C-section. But that was the team's recommendation. And then she kept insisting that she didn't want a C-section. And the question in that moment is, what do we do next? And have you all been in those moments before?
Yeah, it definitely happens quite a bit with getting blood, with giving patients blood that have
with your own witness.
Exactly, yeah, where you're like, this will really help you because your hemoglobin is low, this will really help you with this GI issue you're having, but we had to find different ways around it, yeah.
Yeah, and there's room, and I try to not make things black and white because the space can't hold that kind of thinking, is you want to honor patients' culture and beliefs and try to provide safe care for them and this baby, right? But what happened in that moment when she said no was the team kept going back in there, and it became more and more condescending. Like, she didn't really love her baby. And essentially suggested if you loved your baby, you would have a C-section right now. And then it escalated into confrontation, right? And then she eventually had a C-section, and the baby was fine, she was fine, and the team was satisfied, right? They got the outcome what they wanted. They got the outcome they wanted, which was a healthy baby and a healthy mom. But she suffered trauma because of how it happened. And I do think there's room to make space for her worldview, which is that potentially, I don't know the full truth of in what happened in her life, but I do know the Somali community overall, or at least some facts about the Somali community, and I've talked to their leaders, is that they've relied in their faith of God to get them through so many traumatic experiences, way more than what she's experiencing right now, and that they face some horrific conditions. And we were not acknowledging like our own limitations in predicting outcomes. So there's some cultural humility here, right? In that this is the tool we're using, it's imperfect. And at some point, it may definitively show the baby's not doing well, but we need to acknowledge this imperfection too. And I think there's a way in an alternative world where this could have happened, where I could have, or we could have said, yes, like this is what we're thinking right now. And I hear that you want to still try for a vaginal delivery, but our recommendation is a C-section. And then we are a little more patient, and then keep saying that recommendation, but don't turn it into a confrontational encounter or a condescending encounter. In addition, like, question our own assumptions that she's understanding everything we're saying, right? Like, hey, like, I am not from this community. I am an Indian doctor or a white doctor. Maybe I need a Somali community health worker or a doula who can really communicate what we're seeing and hearing, so they can bridge. And maybe she doesn't understand the seriousness of this if we're really thinking it's serious. So there's a lot of questions we could have asked and approached differently, that it wasn't such a horrific encounter for her, even though we thought we had, quote unquote, achieved the outcome we wanted.
I think that's the fascinating thing with different cultures, that we have these beliefs and ultimately comes down to faith, and we know how important faith is, or the soul part of the human experience for people. But in our Western medicine, kind of cut that away. It's just the body itself and maybe the mind part a little bit. We don't incorporate that part where maybe could improve better outcomes, And again, I'm thinking about the ICU, maybe during COVID, we had people in the worst times and they were spiritually just withdrawn, right? There's this book, who Viktor Frankl is, Man's Search for Meaning. So he was a Holocaust survivor. He noticed that people didn't die from like the lack of food and water. It was like from the lack of hope to live, that willpower. So if we could somehow culturally be competent enough to help instill beliefs and faith and hope into an individual based on their cultural preference, because we can't do it any other way. We can't say, Jesus has your back, grab his hand. Well, we can't, because they don't know who Jesus is in their hearts, but they know, insert their God. So yeah, I agree that being more culturally competent would help healthcare overall. And I'm kind of thinking about the busyness of things. You were mentioning earlier how we have so much little time. Is there a benefit with concierge medicine or no? I noticed there was a couple doctors in Illinois, because I was doing research, how they're moving away from family practice and they're doing more like a subscription model, which ultimately is going to have more time with patient care. Have you noticed any benefits about that, or are you familiar with that type of medicine?
Yeah, I think it's called direct primary care. I think there's where do I start with this? Is there's a way that you can create a system for the affluent and people who can afford it and give them exactly the way you want. But a lot of the problems we have in healthcare system or health insurance system is that it is a large network of cross-subsidization, because there are some people who get really, really sick and some people who don't get sick at all. And the healthy people paying insurance is supposed to subsidize the cost of the really sick people, right? At the basis of insurance. And we can go into what's so expensive, everything from pharmaceuticals to like PBMs, so people have heard about it. We don't need to go into that. I'm saying all of that because the direct primary care model that you're talking about, yes, I can take care of people who can afford the subscription model and come to me, but many people can't. And often the people can't are the people who are in communities that need health care the most in a personalized way. So I don't know if I would go towards that personalized model personally, as you could think about like community health centers and all of that who take care of uninsured folks. If they could monetize people that way, I'm sure they would have done it that way, because I think they're always looking for funding too. But it made me think of, I think you're going back, I'm going to approach it different way this time. It's like, how do you make more time with people? And I still want to challenge people's assumption that time is time, because there's a perception of time too. And I think we can change the perception almost always wherever we are right now, while having this conversation about how do we ultimately change the time itself, without getting too meta here. I'm going to give you an example. I use this example a lot because it resonates with people. I take care of the Native Hawaiian people, Native Hawaiian community, as I mentioned. And one thing that came up when I was talking to a community leader from that community was, hey, like, one thing that clinicians do a lot, which is really frustrating and ultimately leads to a worse encounter, is we show up in the clinic, we show up in the hospital, and they're looking for a way to connect with us, and they talk about their vacation to Hawaii. And I think many people do that. I've probably done that. But then she brought up, like, you're talking about your vacation to Hawaii, but the reason we're here is because Hawaii became unaffordable because of tourism. And that we're now here in this new state, we can't even visit our family because flights are so expensive and that place is so expensive. And now here you are just talking about your vacation, and that's how we're starting this encounter. So one, it points to understanding the historical and structural context of a community to understand that this could be a problem. Not saying I never bring up my vacation to Hawaii to anybody, but now I can ask them before bringing it up, like, hey, like, have you been back home recently? And what is your connection to your home? And they could say, go there all the time, or they could say this, right? I haven't been home in many years because it's been hard. And then two, because if you start out with a negative interaction like that, and that person has to be vulnerable with you of all the things that are bothering with them, oftentimes they're not going to share everything, or they're not going to listen to you because you clearly don't understand. So then they're going to come back with the same problem, or it's going to take longer to save this longer time to like cure or care from the same problem than it would be if they trusted you from the beginning. So part of this is actively not doing things that are harmful, and then that perception of time can change because you can get to solutions quicker when that trust is there between the person and you, right?
Yeah. So coming back to what you just said and making them feel okay to be vulnerable. What other approaches can you use as a physician or as a professional that opens up that room for that patient to feel like they could get your trust or feel like they could be vulnerable without getting maybe judged or looked down upon, or just feel like they're in like a safe space where they could just speak whatever their mind is telling them to say?
Yeah, I think there's some basics of principles of caring for people, right? It's like you pay attention not just to their words, but their body language and what's being unsaid in the tone they're using. So there's principles of caring I think we're probably all think about, which we lose because it's rush system and we get caught up in our routines. I think that's important. But the practices, which is like how do you actually make it real of like paying attention, is for me like being really diligent about learning about the communities and cultures, but also making room for a conversation to go that way, right? So let me think of another community, Pacific Islander community. Again, I'm just using a community that's familiar to me. So people could come in with any kind of medical problem, right? That's the reason they made the visit, or I made the visit for them. So I talk about that, but I also bring up other things that I know about their culture to see if it's relevant for them. So for the Pacific Islander community, there is that idea of fa'afafine, which is gender fluidity, that is present in their culture. It's essentially LGBTQIA all encompassed into one word because gender is fluid, right? We just say fa'afafine. And so when we're talking about sexual activity or partners, sometimes I bring that concept up and they could say, oh, like, that's not me, or there's a moment of surprise there, right? Like, oh, like this person knows about me. And nobody expects you to know everything about them or culture because they know people don't. But it's like, this person was curious enough to learn about my culture and will be interested if I shared more. Because so many times what I've heard for patients when I have these conversations is like, hey, like I actually stopped explaining about anything about myself or culture because people didn't seem to care. Like they were like, okay, like let's go on with the reason we're here. And they clearly didn't care enough to know even a little bit about the community. So making that first step or taking that first step has been helpful for me to bridge that gap. But I think I answered your question.
Yeah. I love that. It seems like we need to fundamentally give people the ability, or our patients an understanding. At least give them the open hand to let them know that, hey, we want to understand you. We're curious enough to pour into your own cup so they could become vulnerable per se, have that courage to let us know more about them other than why they're physically here from an emotional standpoint or psychological or,
Great summary.
And you're also a medical director. So what is a medical director for those that don't know?
I think it probably, depending on your system, it means a lot of things. But for being the system that I am in, it's managing the clinicians in our medical building. And then I'll be managing a few other clinics too, because they'll take a bigger role within our organization. And if people ask me what my role is, without getting into the weeds, is probably about a few different things. One is providing access to patients. Of like when patients call to get a visit with their doctor or clinician, can they get that appointment? If not, how can we make it easier for them to? To quality, like are my clinicians providing quality care? Every doctor is in a spectrum of how they treat patients, and we want to make sure they're providing a quote unquote quality care. We don't need to go into defining that, but also like, are the patients that we're taking care of getting the cancer screenings, like breast cancer screenings, colon cancer screenings, or their blood pressure controlled? So there's a population level work there. 3 is patient experience, like when you come, are you having a good experience? I try to not make that conversation about like consumerism, where like it's like you're not coming to Target to get antibiotics, but just like you want to have a good experience and not feel like it's like a horrible to get the care you need. 4, and that is equity of like, hey, like is blood pressure better controlled if you are Indian and white, and not if you're a Pacific Islander? Why do people who are Pacific Islanders have worse blood pressure control, and what do we do about it? And then the last is people of like how important it is to take care of your people, right? Not your colleagues, like the things that go through their personal life and balancing their family and work life, all that stuff. So trying to do all of that, and I do think it gives me perspective. And how do we say this? Like renovating an institution organization, it helps me understand the complexity of change and where all we need to make improvements on, even if I don't have power to make all that change right now.
Raj, I'm kind of curious, how important are patient satisfaction scores? Because there's been facilities that I worked at that are like, we need to boost our patient satisfaction scores. You have to do everything you can around these patients to boost them up. But then other facilities are like, don't worry too much about them. They're not that big of a deal. So are they really that important to facilities, or is it just, do you get like funding from it? How do patient satisfaction scores influence like a facility?
Depends on, and this is like, there's so many stakeholders in healthcare, right? Depending on who you're asking, their importance is different. But if you're health insurance, patient satisfaction can inform if you get the rating that you want. So people see that in the marketplace and sign up for you. So there's a lot of things on the line, right? Are they going to choose you or not? If you're a provider, patient experience could be the one of the factors that patients decide to come to you or another place. So it's like an external rating system, right? It's imperfect. And I would probably fall in between making this patient experience score, like do everything you can to improve it versus let's not think about it twice. And I think there's a way to approach it with the growth mindset where you look at it and ask yourself, hey, like, is there something that I'm doing repeatedly? Because actually the score is just a marker, and there's a lot of information if you dig into it, right? That says, I'll just, again, speak from my perspective because it varies depending on your department. As a clinician doing outpatient medicine, there are like 8 or 9 questions, and there are different categories. One is, did my doctor make me feel like I care for? Or did they review my medications with me? Was my follow-up plan clear? So I could look at my data and look, hey, my experience is okay. And then, wow, like the follow-up, and like there's so many patients that aren't clear with me. So then I can reflect and say, like, how can I make that clearer and better for my patients? Or is that a system issue? Like they just can't get back in to see me. So you can use that score as a marker for improvement and see where you're falling short or could get better. Because we're all trying to get better one way or another, right?
Yeah.
One last question I always ask our guests in their episodes. So if you had an opportunity to have a cup of coffee with anybody one last time, who would it be and why?
Yeah, I was thinking about this. It was tough to think about it for myself, but I'll say it'll be Paul Farmer. Do you know Paul Farmer? He led Partners in Health, which is an international NGO. Has done a lot of work in Haiti. He follows his philosophy of liberation theology was based on Catholic tradition, and the history is from Latin America, I think. Part of it is the belief of accompaniment, which is how do you accompany somebody through their suffering and hold their hands until they feel better. So there's a humanness to that approach. And the reason I would want to have coffee with him is his philosophy was that everybody, all the children in the world are my children. There's a selflessness to that. Because now that I have children, I can feel myself becoming more selfish of like protecting my children, doing things for my family. And he approached it, and he had a family too. And there was a book written about him, I think called Mountains to Mountains by Tracy Kidder, and how he let down his own family because he thought everybody was his children. And so he missed his own child's birthday and all this. And I think I want to have a cup of coffee with them to understand how he felt doing that. Because it's so counterintuitive, and I don't know if I can ever make that decision, but I want to understand better. Like, hey, this child in Haiti is suffering, and they need me to help them somehow, and I'm going to sacrifice an important moment in my own family's life because this child who is also connected to me at this higher level, this consciousness level, needs my help. Yeah, there's probably no easy answer, but I want to know. I want to know what that answer is.
He's an interesting guy. It seems like a mixture of being altruistic, a humanitarian, somehow becoming selfless, where he saw everybody like his brother and his sister in a sense, because we're all from the same source, essentially. So that's beautiful.
Yep.
And if people want to hear more about your work, what you do, potentially your podcast, where can people go online to find you?
The easiest way to find me is just go to healthcareforhumans.org, and all the links are there, including the link to Instagram and Twitter. And check out an episode if you get a chance.
We really appreciate you getting on the show and sharing your perspective. I think a lot of nurses need to hear how important culture is. A lot of times, just like we talked about in this episode, everything is so fast-paced where it's just treating the patient here, but not really understanding them for the humanist, for the person that they are. So thank you for sharing your work in Western society, and I hope it keeps growing. We keep becoming more culturally competent, and we can make great change happen from every aspect of healthcare, including this side. So thank you for what you do.
Thank you so much for having me. Really appreciate it.
Oh, I gotta go. I've been working, told them please don't hit my phone. I'm in my zone, bruh, just leave me alone. Was on the road, but I swear I'm coming home. Now the drinks on me, I think we need a toast. See, I did it for me. Now my